Good morning, dear students. Today discussed about the local anesthetics, different categories. Previous class we discussed about all the mechanism of actions and their classifications. Now today discussing local anesthetic which is used as injections. Mainly this procaine. Procaine is a diethyl aminoethyl ester of pharma. It was the first synthetic local anesthetic. If you comparing to cocaine, it is equally effective as cocaine but is less toxic one. But is not used topically due to its poor absorptions from mucous membrane. And this procaine is not commonly used due to its delayed onset, short action, low potency and availability of better agents. It can be used for infiltration anesthesia and for nerve block of short duration as needed for diagnostic purpose. Chloroprocaine is a chlorinated derivative of procaine. Its main advantages, this shows the rapid onset, short duration and reduced acute toxicity. Its older formulation has produced prolonged sensory and motor blockage after spinal or epidural anesthesia. But its newer preparations usually contains calcium EDTA as preservative and this helps to reduce the neurotoxicity of drug. Better to avoid this agent for the purpose of intrathecal administration. Tetracaine is an amino ester category, is more potent and longer action if comparing to procaine. It is more slowly metabolized and causes more systemic toxicity. This tetracaine is mostly preferred for spinal anesthesia if prolonged action is required. For peripheral nerve block, bupivacaine is preferred over tetracaine because this one shows the slow onset, high dose is required and potentially toxic. So for peripheral nerve block, bupivacaine is preferred over tetracaine. Atropine is a newly introduced amide-linked local anesthetic. It has rapid onset and is acting about 6 minutes. Duration of action is about 1 hour. Suitable for short procedures like dental and periodontal procedures. Epidural is an amide-linked local anesthetic. Onset of action is similar to lignocaine. Duration of action is long and is similar to bupivacaine. Epidural mainly produces preferential motor blockage as compared to bupivacaine. This drug is useful for surgery that required good muscle relaxation. It is a cardiotoxic similar to bupivacaine. Oxythiazine, this drug is mainly ionized at acidic pH, so this produces the local action on gastric mucosa. So these local anesthetics mainly used in gastritis, drug-induced gastric irritation, esophagitis, heartburn. Oxythiazine is also combined with antacid preparation as gel. These are some of these local anesthetics used for ocular anesthesia. This is proparacaine, tetracaine. For topical ocular anesthesia, that is for corneal conjunctival anesthesia. Tetracaine is mainly used as ocular surgery as 1 to 2% ointment or drops. Cocaine was the first agent used for ocular anesthesia, but soon it had fallen disuse due to its corneal clogging and mydriasis. So now tetracaine is most preferred for ocular surgery as 1 to 2% ointment or drops. Proparacaine is a less irritating to eyes and less antigenic, so can be used in patients allergic to amino ester local anesthetic. Duration of action depends on vascularity of tissues. Duration of action of proparacaine is long in cornea provided it is normal, is longest, and short in conjunctiva if it is inflamed. These are some techniques used in local anesthetic administration, mainly topical or surface anesthesia, infiltration anesthesia, field block, nerve block. Surface anesthesia is topical anesthesia. Mostly this local anesthetic is applied on the ablated skin and mucous membrane, mostly like this oral cavity, nose, eyes, throat, upper respiratory tracts. Surface anesthetics are available mainly as solutions, ointments, jellies, patches, creams, lozenges. These are some important content that is included in local anesthetic solutions. One local anesthetic agent and added vasoconstrictors, reducing agent, preservatives, fungicides and vehicle. Reducing agent usually use this sodium metabisulphite is a good antioxidant and reducing agent. Preservative, this methyl paraben is used. This helps to increase the shelf life of anesthetic solution. This also acts as the bacteriostatic agent. Fungicide, mostly this thymol is added. Vehicle, this modified ringer solution or distilled water to give volume. The surface anesthetics mainly classified as soluble or insoluble. Soluble ones are cocaine, lidocaine, tetracaine and benoxynate. Insoluble, benzocaine, oxythiazine, butylamino benzoate. Topical anesthetics are useful before injecting a local anesthetics, subgingival or periodontal scaling. These mostly prefer this tetracaine 2%, lignocaine 2 to 10% and benzocaine 1 to 2%. Mostly this addition of adrenaline, this does not prolong the duration of surface anesthesia because of poor penetration. Prolonged administration of topical anesthetics in eyes are retarding, healing, clogging of epithelium of cornea, predeposition of infection. Self-administration should be avoided with these drugs. Nerve block. This nerve block, that is nerve conduction upon injection into the region of nerve plexus or trunk. This mainly used for surgery, dentistry, analgesia. Field block techniques is deposition in proximity to the larger nerve branches. Local infiltration, small terminal nerve endings are anesthetized. So in infiltration, that's the direct injection into tissues to reach the nerve branches and terminals. So this can be superficial as well as deep. It's mainly used in minor surgeries. Infiltration anesthesia, this local anesthetic is injected directly into tissues to be operated. It blocks the sensory nerve endings. Is used in minor surgery, immediate onset with variable duration. These types mainly involves the skin region as deep as intra-abdominal tissues. These most local anesthetics are used as infiltration anesthesia. Examples like lignocaine, adrocaine, bupivacaine. Addition of adrenaline to local anesthetics. Here this prolongs the duration of anesthesia. What's the advantages of this infiltration anesthesia? That is, adequate anesthesia is produced without affecting the normal function. Main disadvantages is drug record is more as compared to area anesthetist. And problem occurs where these local anesthetics are used for major surgery in which there are more chance of systemic toxic effects and toxicity is more common. In field block anesthesia, this injecting the local anesthetic near the apex of the tooth blocks larger terminal nerve endings at the apex. Local anesthetics injected into the maxillary region above the apex of tooth and to be treated to produce field block. This technique is used in minor procedures, scalp, anterior abdominal wall, upper and lower extremities, in which smaller dose produces larger area of anesthesia. Nerve block anesthesia is the local anesthetic injected very close to or around the peripheral nerve or nerve plexus. It produces large area of anesthesia than field block. In nerve block anesthesia, the requirement of local anesthetic is less than that of the field block and infiltration anesthesia. So this main purpose of nerve block anesthesia is to abolish pain and other sensation. Spinal anesthesia is the most popular form of anesthesia. Local anesthetics, here this administered or injected into the subarachnoid space to anesthetize spinal cord. Is used for surgeries to abdominal, pelvic or legs when can't use general anesthesia. It causes anesthesia to lower abdomen and limbs that are anesthetized and paralyzed. This can be administered in patients of hepatic, renal and cardiovascular disease. Spinal anesthesia, and this also useful for this woman during the late pregnancy need fewer doses of spinal anesthesia. Spinal anesthesia is used for surgeries of lower limbs, spells, lower abdominal fractures, cesarean operations. Mostly this lidocaine, tetracaine, this can be used as spinal anesthesia. The spinal anesthesia is compared to advantages comparing to general anesthesia. Comparing to general anesthesia is safe, it produces analgesia and muscle relaxant without loss of consciousness. Diabetes, cardiac, renal disease, pulmonary disease, this do not interfere much and pose less problems in treatment. The level of anesthesia is influenced mainly by site of injection, amount of fluid injected, force of injection and specific gravity of drug solution and position of the patient. These are the commonly used local anesthetic for spinal anesthesia: lignocaine, tetracaine, bupivacaine. Addition of adrenaline to spinal anesthetic increase the duration of intensity of block. Spinal anesthesia can be used for surgical procedures below the level of umbilicus, thus lower limb surgery, cesarean section, obstetric procedure, surgery on perineal appendectomy. What are the main complications of spinal anesthesia? Headache, hypertension, respiratory paralysis, septic meningitis, postoperative urinary retention. Next we come to the epidural anesthesia. What's epidural anesthesia? Here this local anesthetic is injected into the epidural space where it acts on the spinal nerve roots. Lignocaine and bupivacaine are the most commonly used. It is safe, but the technique is more difficult comparing to spinal anesthesia. Epidural anesthesia is slower in one set comparing to spinal anesthesia, and it requires much more large amount of drug and is useful in obstructive analgesia. Epidural anesthesia has three types depending on the site of injection. Thoracic injection, this mainly administered in the mid-thoracic region. Here the epidural space in this region is narrow, smaller volume of needed and is a wide segmental band of analgesia. In this thoracic analgesia is used mainly for pain relief of thoracic or upper abdominal surgery. Coda injection anesthesia, in this injection is given in the scrotal canal through the scrotal histus and produces the anesthesia of pelvic and perineal region. It is mainly used for vaginal delivery, anorectal and genitourinary operations. Lumbar anesthesia, here the large volume of drug is needed because of the epidural space is here wide. It produces anesthesia of lower abdominal, pelvic and hind limb. Next we come to the local anesthetic toxicity. Toxic symptoms usually develop in neurologic and cardiovascular symptoms. Systemic toxicities like numbness or tingling of tongue, anxious, drowsy, complaint of tinnitus. Neurological symptoms like convulsion, coma, apnea. Cardiovascular collapse may result from the direct myocardial depression, conduction abnormalities. And this neurotoxicity is more common with lignocaine and cardiotoxicity is more with bupivacaine. This bupivacaine usually causes irreversible cardiac arrest. Single most important factor in prevention of toxicity is the avoidance of accidental intravascular injection. These careful aspiration tests are vital and should be repeated each time the needle is moved. The drug dose should be calculated accurately in the pediatric age group. Next we come to what are the drug interactions of the most important local anesthetics like lignocaine, procaine. Lignocaine shows the drug interactions with the propranolol. Propranolol is reducing the hepatic blood flow and this impairs the clearance of lignocaine. This results the toxicity. If this lignocaine is administered with adrenaline or tricyclic antidepressants, this precipitate hypertensive crisis. Procaine, if combined with sulfonamide, this procaine is usually hydrolyzed to PABA and this reduces the effects of sulfonamide. Lignocaine with adrenaline and propranolol, these are dangerous. This rise in BP due to the unopposed alpha action of adrenaline. This is iterate mixture of local anesthetic, that's the lignocaine and prilocaine, 2.5 percentage of lignocaine and prilocaine. This mixture is local anesthetic mixture is called as this eutic mixture. Here this the melting point of the mixture is less than that of the either compound alone. This can be anesthetized intact skin. This EMLA has been applied 1 hour before the procedure and is used for the dermal anesthesia during venesection and skin graft procedures. It should not be used on mucous membrane or abrated skin. Mainly contraindicated in patients with medulloblastomia and infants. These are some important methods and uses of local anesthetics here summarized. For surface anesthesia, we can use the lignocaine, tetracaine, benzocaine, and infiltration lignocaine, procaine, bupivacaine, and ropivacaine. And for this field block, lignocaine, bupivacaine, nerve block, most of anesthetics can be used. And to anesthetize gastric mucosa, this oxytocin, this most helpful in case of peptic ulcer. Next we come to the discussion session. What's the most potent and longest acting of local anesthetics? We discussed all categories of local anesthetics, their duration of action and everything. So you find out the answer, which one is the most potent and longest acting local anesthetic agent. In all are the true about bupivacaine except duration increases with ordinary, long acting, cannot be given in IV, less cardiotoxic comparing to lignocaine. Which one? We can find out the answer. Okay, these are the assignments. What are the important techniques for local anesthetic administration? And name 2 local anesthetics used for spinal anesthesia. Then what are the important complications of spinal anesthesia? Okay, thank you.